Hello and welcome to Wellbeing. I'm Jack Hodgins. Today we'll be discussing the health of Aboriginal and Torres Strait Islander people. We are joined by Dr Josephine Gwynn from the University of Sydney. Dr Gwynn has worked closely with the Aboriginal community and her research focuses on young Aboriginal people and their nutrition, physical activity and well-being. Dr Gwynn is also a member of the Charles Perkins Centre, which focuses on improving global health. Hello Jo and welcome to the program.
Hi. Thanks for inviting me.
In a health context, Indigenous Australians, when compared with non-Indigenous Australians, are 2.7 times as likely to smoke, 2.1 times as likely to die before their 5th birthday, and pass away on average 17 to 18 years earlier than their non-Indigenous counterparts. Upon reading information like this, published in the Australian Institute of Health and Welfare's Australia's Health 2018 in Brief Report, it becomes clear that there is a gap between the health of Indigenous Australians and of non-Indigenous Australians. What is this gap and why is it occurring?
They're two very big questions. And very important questions to understand. And I think it's, if I may just divert just very, very briefly, just make it very clear that I'm not an Aboriginal or Torres Strait Islander woman, that I've worked with communities for over 30 years or so, but my experience is, and I'll be talking about that work and my experience and views. However, it's important to note that my background is very much white middle class Australia,
Yep.
And I therefore, even though I reflect upon that and work within communities, that is part of the journey that comes with me inevitably. So I think it's important to make that really clear. Yes, the gap. So the gap in health is not shifting very well. And in fact, the federal government is doing a bit of a refresh around the gap in health that exists between Aboriginal, Torres Strait Islander and non-Indigenous people in Australia. And at long last, and after repeated efforts over a long period of time by Aboriginal people, their peak organisations and Aboriginal leaders, they are taking on at least a partnership approach to the Closing the Gap strategy. If not, and where they should be moving to, is Aboriginal Torres Strait Islander leadership around the Closing the Gap strategy. This has been absent until now.
Right.
Informed but absent, led by the federal government and its various organisational components. So I think when we see that refresh start to play out, we may start to see change. And that's an important thing to recognise. An example, I know I'm diverting slightly, but it gives a bit of context.
That's all right.
Is that last year when COVID hit, the federal government and the peak organisations and the Aboriginal communities were very concerned about the impact on Aboriginal communities. The federal government asked the leaders in the community to what should happen, followed the leadership of the community of its peak organisations, and there was an outstanding result within Aboriginal communities around Australia. The rates of COVID were 6 times lower than the rest of the Australian population. No one died, no one was in intensive care, and there were very, very few people, and I don't think there were any in remote and regional communities. Largely it was in urban communities. So this is an outstanding result. And Aboriginal and Torres Strait Islander communities led the way for Indigenous communities internationally as well. The critical thing in this is that the communities were asked to lead and were given the trust to lead the response in their communities and to tailor the response for each community's needs. And they did that very successfully. Now, Australia's been very slow to acknowledge that Aboriginal Torres Strait Islander leadership is critical for health and critical for the improvement of closing the gap. This has been repeatedly asked in reports, in statements, the Uluru Statement, the Redfern Statement, and yet it largely falls on deaf ears when it comes to the crunch. So coming back to what you asked earlier, essentially why do we see these things? Let's take smoking rates, for example, because this points to the intergenerational effect of 230 years of, marginalisation, extreme poverty, disadvantage, and everything that entails, and the impact of that intergenerationally. When Aboriginal people were removed from country after the British invaded, when they were put on, put into missions and stations, by that I mean, country in the rural areas, etc., they were totally dependent on food provision. And the food that was provided was appalling.
Right.
Now, the context of this, I suppose, is also that food in provisions was poor in other parts of Australia, but particularly so for Aboriginal people who were dependent, were not financially independent, were in fact not included in the census till 1967.
Mm.
So the food that people received was, sugar, tea, cigarettes, flour, and occasional poor cuts of meat. It's largely the sort of diet, which caused all sorts of health problems, but also caused a sort of dependency as well. If you're handing out cigarettes for people to have, then it becomes part of what people do and has an intergenerational effect. So there's that component to all of this, which is very dominant. That there's been that the effect of all this is still felt very much in many, many communities. Of course, the removal of children is a terrible thing that happened and continues to happen, and has enormous impact on the way communities feel they cannot trust government organisations, including health services, and certainly many don't feel safe in coming to mainstream health services because of their experiences of racism, and this is still current today. So there's a very complex, very long history of all of that in Australia, which still exists and still plays out in the health statistics that you just talked about. Another factor to all this is the availability of appropriate health services that people feel they can come to and they can feel culturally safe. This is a real problem for many Aboriginal people, and it puts people off going to see the doctor. And when the support services also aren't there to provide people with the necessary health supports, then that's another factor. There is a very good network of Aboriginal medical services across Australia. These services do provide support to Aboriginal people. They still need to be further supported and ramped up in terms of the services they can provide. Some are better resourced than others. Things like dental services are just coming into some services which should have had these a long time ago. So there's those are sort of complex background. Not every Aboriginal community, of course, is experiencing the extreme poverty that existed, or still exists in some communities. But everybody will experience the effect of that which, their grandparents, parents and grandparents, and back from there experienced on a day-to-day basis. I work with some communities in New South Wales, remote communities, who do not have a food supply.
Right.
Have to travel. There's no public transport, of course, in these areas, so they have to travel with their own personal transport to get to the nearest town to purchase food. The water supply has a history of being unsafe, unpalatable, and is not trusted. And so, you still have communities in that situation in this day and age, and that doesn't help health.
No.
It doesn't mean that people can live a healthy life. Although it's difficult to access not the basics of life.
Building on top of that, so Australia is a first world country, but it sounds like the way you're describing it to me that some Aboriginal and Torres Strait Islander people seem to be subjected to third world conditions.
Yeah, and I think that's been recognised internationally, and is to Australia's shame that this continues to persist for some communities. I should point out that there is enormous resilience within communities, and that there are enormous strengths within communities. And as with the COVID response, if communities are given the trust to lead their own response and lead, if not co-partner, but preferably lead the services within their communities, lead the responses within their communities, then there are really good results. And Australia has to be much more responsive to that call and to the evidence that exists around the positive effect of that approach.
You're listening to Wellbeing, where we are discussing the health of Aboriginal and Torres Strait Islander people with Dr Josephine Gwynn from the University of Sydney. Let's talk about you for a moment. What is your background with working with the Aboriginal and Torres Strait Islander community? What is your story?
My story? Well, I suppose I'm a slightly older woman now, and my story is the first half of my life was I had middle-class Sydney white upbringing, not affluent, but certainly middle class. My mother's family were all people from country Victoria, so I was the first generation on her side to grow up in a city.
Right.
I never heard stories about the Aboriginal people that must have been in those parts of Victoria, particularly when part of her family arrived in the gold rush. It just wasn't part of the history handed down to me, and I think that was very common in Australia. It's only now that we're starting to talk about, my ancestors didn't just go to Western Victoria, find land, empty land. They had to move people off the land before they could use it, and they took over that land. And there's no dialogue about that in my family, that side. My father's Anglo-Irish, so he arrived here after the Second World War, met my mother in the Antarctic Division, which is another story, and he was new to this country and brought. So I suppose I have a very strong roots in my Irish heritage, Celtic heritage, like many Australians. But and I was vaguely aware of discussions around what at that stage was the tail end of the period of assimilation, which was preceded the sort of policy period around ensuring that Aboriginal people had the rights to their own decisions in their own lives and their own communities. Assimilation was all about, bringing everybody together. We're not different. We'll all be the same, which did not acknowledge the importance of Aboriginal culture. As we're doing today, we understand the real importance of Aboriginal cultural knowledge to the management of Australia's climate, to the management of Australia's health. We're only just starting to understand and appreciate the richness of that knowledge and culture, which has been a long time coming. But 30 years ago, myself and my husband moved to live for a few years in remote East Arnhem Land,
Right.
in a remote community. And that was really the life-changing event for me. I didn't realise much at all really about Aboriginal communities. I did not understand the depth of racism that existed amongst my fellow white people in Australia until we lived in a smallish area where there was a mining community as well. And this was the Wanandiliaqua people of East Arnhem Land. I did not realise the extent. I didn't realise racism existed very much. I didn't understand the depth of it in Australia and the breadth of it, and I didn't understand anything much about Aboriginal communities. And we had the most extraordinary life for a couple of years. I grew to understand about Aboriginal languages, how people can speak 5 or 6 languages. And there's a richness of Aboriginal languages that exist that I knew nothing about, and I don't think at that time many people in Australia were aware of. I was very privileged to work closely with some members of those communities around a particular health issue in the community. And I was very privileged to have the wisdom of one of the tribal elders help me along the way with the work and guide the work that we started to do. he was a very strong influence, and to have had the privilege of working closely with traditional people and get their wisdom and their guidance on our initial journey, my initial journey in working with Aboriginal communities was an incredible privilege and has guided me ever since.
Right.
And so, I mean, I just could not believe the things I heard non-Indigenous people say. I just couldn't believe it. And incidences that happened, it still profoundly disturbs me to this day. And I know these things haven't gone away. They haven't changed. Currently I'm one of the investigators on an Australian Research Council grant led by an Aboriginal academic at the University of Sydney, Associate Professor John Gilroy. Right. And we're looking at the Indigenous workforce, both the sort of retention factors, but what's the push-pull factors for people staying in a job or leaving a job in the disability, healthcare and aged care services. And whilst that's still a research project in being rolled out, so we can't talk about the results. We don't know those yet.
Right,
but
right.
The research that informed that research that we're currently doing has made it very clear that racism exists in Australia very profoundly. It's part of institutional racism exists, and a very well-known and good academic has written a paper on this recently and had that recently published. And explains what does this look like and what is it. It's a very good read. I could dig it out somewhere if you were interested, and very informative. Anyway, that's the diversion. So I divert.
That's all right. That's all right.
Bring me back. So after when we left East Arnhem Land after a few years and came to live in Newcastle, and I continued to. When I started work at the University of Newcastle, where I worked for, must have been quite a while now, maybe 15 years, maybe more. And I did my PhD there, but I also had the privilege of working with key Aboriginal leaders in both at the university, but also outside the university in relation to curriculum, content, and research activity. And I started my PhD at that point working with the North Coast communities. So I was running both my own PhD, but also a research project around nutrition and physical activity amongst the Aboriginal and non-Aboriginal children on the North Coast, and was there we did this project for about 10 years. It was a very strong capacity building aspect to that. We employed people locally led the project in their communities, and we had a strong Aboriginal Torres Strait Islander community governance structure over that research, which built up over that time. So that was my next sort of big, lengthy contact, I suppose, around working closely with communities. And then since then, when I've moved to the University of Sydney, I've been working with the Posh Centre for Indigenous Health, based there, and many of the communities that the Posh Centre works with across New South Wales and indeed across Australia. So that's sort of in brief my experience.
In Australia, we have about 82,500 medical practitioners, but based on 2019 data from the National Indigenous Australians Agency, of the 82